School of Hip Hop class is back in session. I'm your local lady Woo, host of the show. Let me get some noise behind me, please. Let me know y'all ladies. Alright, tonight we're discussing health topics. They say that health is, we're about to see it. Mentally, I'm not sure. Physically, maybe. We're gonna talk to the guys right now. We have Dr. Michael Wiggins in the building from the Urology Centers of Alabama. He's been on the show before, and it got very interesting with the guys. So we kind of want to get back to that where we left off and let some more people get some of that great knowledge that we shared. Dr. Wiggins, tell me a little bit about what it is that a urologist does.
Well, certainly I think we take the lead on men's health. We deal with men with problems of the urinary tract, in particular prostate disease, whether that's large prostate urinary problems or prostate cancer, which probably is the most prominent topic that we deal with. We're just coming off of, as you stated earlier, Prostate Cancer Month, September being Prostate Cancer Month, and trying to increase efforts to bring forth awareness to the general public so that we can get men in and get them screened, in particular the African American community.
Okay.
Because African Americans can have up to 3 times the incidence of prostate cancer than other communities.
Right.
And the death rate can be higher. It seems that men in the African American community, we tend to have a higher rate of aggressive cancers that kill our people a lot faster.
Right.
So it is important that we do these type of shows and get that information out to the public, so we can get men screened and get them diagnosed and get them cured.
Okay, when you say get men screened, what is the age? Can boys come or just men?
Well, typically right now we look at the screening process starting at the age of 40. You know, that's generally a good cutoff.
Yes.
That's for prostate. I wouldn't say men's health.
Okay.
And you know, we were talking about that, and I'm gonna diverse for a second because we were talking about that earlier about why don't men go to the doctor? And I do think it's a cultural thing. I think that women, the culture is they know they're gonna get pap smears at a certain age, and they're gonna do breast exams, and they're gonna go to the doctor. But it seems to be with men, we sort of run from that. And if it don't hurt, it don't bleed, we can't sleep, then I don't need to go to the doctor, I'm fine. And the problem with men's health issues are that they're usually silent issues that kill you silently. And you don't know you're having those problems. Problems with high blood pressure, diabetes, all these other things that can affect our communities that we don't even know about. And the other thing is that men typically have higher rates of diseases than women. And men typically die at a higher rate than women. So it's sort of kind of backwards the way we approach that.
Wait a minute. So men have, you said, more disease than women?
When you look at the highest rates of when you look at cancers and cardiovascular diseases, heart attack, strokes, and what have you, the graphs are that men actually diagnose higher and die at a higher rate. And they're typically at about 65 is where it's sort of kind of, and we believe part of that is the estrogen effect that is protective. We believe that part of that is the testosterone effect that's not protective. And so we think that the testosterone leads to more cardiovascular problems, and the estrogen in women sort of protect them against that. So as women go through the change of life, and as men go through their change of life, male menopause, they sort of kind of equal out.
Okay.
And but until then, men have a higher rate of mental diseases. Men have a higher rate of cardiovascular diseases, i.e. strokes and heart attacks, what have you. And we have a higher rate of cancers.
What about STDs?
You know, yeah, that number I don't know.
What about like married men versus unmarried? Because women will stress you out and you will have a heart attack. You will go crazy. So.
Well, I mean, with your point, well, I won't say that, but I want. I will say stress. And I will say stress. You look at things that are going on in the community, the economy, and what have you. I mean, stress is a huge player in cardiovascular disease and strokes and heart attacks and what have you. So that's your point. I'm not going to link that to women causing stress, but I would add that's a great point. But one other thing is that I truly believe that as far as men in our communities, we don't have a prevalence of young men going to their pediatricians. Right. When I deal with other communities, they have the pediatrician, and they sort of transition from the pediatrician to the doctor. They get screened, the family doctor, and they're starting off in their 20s. It's a common thing. When they come to see me in their 30s and 40s, they have family doctors. Then, as opposed to a lot of African American men, you know, typically on average, I see they'll probably get into the system. They'll probably get introduced back into the system in their 50s.
Let me ask this: how many of you all went to the doctor as children? And then after your parents stopped driving and you started driving, did you still go?
No. Yeah.
Yes.
I stayed.
No.
Yes. What?
Yes. Well, I had sickle cell, so
Okay.
I was in and out of the hospital, you know, a bunch
Okay.
as a child. But you know, I think insurance really kind of plays a part of it.
And
You know,
we'll get to that too.
He's right. That I go because I have insurance.
Right.
It's a mental thing about I pay for it, I'm gonna use it.
right.
Okay, we have a question in the audience.
Yes, I know this is probably a little off the topic, but I want to talk about colon cancer. For instance, like I try to make my husband go all the time to get his colon cleansed or checked, and I hate to be a little graphic, but most of the men, they was like they don't want anything going up their rectum. So how could you, or could you tell me how could I convince him that he really needs to go do this?
Okay.
Well, you know, there are pretty specific guidelines on when a man should go get his colon checked. Outside of if he doesn't have a family history or risk or any other risk factors for colon, if he doesn't have any of that, then he probably don't need to go get his colon cleansed. I would probably agree with him.
Well,
on
let me
that.
ask her, what would make you think that he would need to go do that?
I don't like his eating habits.
Oh, okay, okay.
And he just started working out.
Uh-huh.
I went and got my colon cleansed, and I'm very regulated, you know, but I just feel like he's not as regular as me, and I just think he needs to go get his colon cleansed and
I think
checked.
it's signs of like
Married
bleeding
versus
from the rectum and
unmarried.
stuff like that. Is
You
the
would
reason.
say things you should look for. not
Yeah,
just
things
go.
you should look for. He can, you know, correct me if I'm wrong, but bleeding from the rectum and diarrhea and stuff like that would be a reason to get something put into you to pull something out.
Wait a minute.
Because it just don't seem like something that you would.
But the terminology here is just awful.
She couldn't talk me into that though. You know, even as, you know, just like, I just couldn't see a topic of my wife or a girl or anybody saying, hey, let's just go get it clean. You know?
Okay, all right. Let's talk about, let's get a little bit deeper and see if you would just go on your own. Let's go back to the prostate. What is the prostate? Is it a gland? Is it a cell? What is it?
Well, what the prostate is a gland that only men have, and it's part of the male genital tract.
Okay.
And the purpose, what God intended for the prostate to do is a pro-fertility organ. So when a man ejaculates, part of that fluid comes from the prostate gland, and what it does is it allows the sperm to be able to live inside the vagina. Otherwise, the vagina would kill the sperm because it's so acidic.
Wait a
And
minute.
Wow.
So the prostate is kind of like birth control?
No, it's a pro-fertility. It facilitates fertility.
So it's not it's the opposite.
Right.
So what I'm saying
It's encouraging.
this is what I'm saying then. Guys, if you had the option, would you just get it removed?
No.
No,
Why not?
Because you just took your.
it's still unnecessary surgery.
Okay, all right. I'm just
ain't-
wondering.
I ain't nobody going down there if they ain't got to.
But you know, like we have to remember to take pills or either you know, just all different things women do. All you have to do is buy a condom. You don't want to, but then you got a prostate that basically that's what it's for. Why not remove it?
But you might find that person you want to have.
Okay, whatever. So
A vasectomy would be an easier.
okay, don't just take the whole prostate out. Okay.
You know,
What is
interesting
it?
enough, I had a patient come in Friday, had a 46-year-old that just got married. His wife was younger. They want to have children, and they're looking at getting their prostate removed because of cancer.
Okay.
And actually, they haven't been a 46 year. That is on the young end of prostate cancer. But those are issues they have to deal with now because she doesn't have any children. She wants children. They've talked about having children. They just got married. She's younger. And the reality is, if he gets his prostate removed or if he gets treatment, he probably not going to be able to have children. Other than the next thing they're looking at is banking sperm, so that potentially she would be able to get pregnant at a later time.
Prior to this moment, did you all know what the prostate was for?
Not at all.
Not at all.
And you
I just
had
knew
it?
it. I knew on Family Guy there was a bad chick when they checked for the prostate and it just didn't sound.
Where is it?
Yeah, wait, hold on a second. I'm glad you said that. I'm glad you said that because again, again, that's why this is important, because we get our education out of shows like Family
Right.
Guy. That's what it's up to you, but it's just that that's what people, that's what our community are getting, or some other TV show that are just out there for comic relief. But I'm sorry, what was your question?
Where is the prostate?
It's located inside. It's located under the bladder, in front of the rectum.
And about how big is it?
Typical walnut size, but it can vary between walnut to grapefruit size. But on general, around walnut.
Well, that's a big difference.
You know, and it's a big difference when you're trying to take them out too.
Oh,
Grapefruit size, is
Is
that
it
normal?
is it a utensil? Is it a utensil used, or is it the doctor used? You know what I'm saying? What?
I mean,
you want to talk about the
I'll be honest.
screening.
I had it. I mean, my doctor came in one day. They laid out all the necessary equipment for a
To
prostate
keep-
check, and
I mean,
I got scared. I'm not gonna lie. I looked at him like, okay, I'm
What did he
really
lay out?
uncomfortable now. And then he looked at my chart and he said, "Oh, wait a minute, you're not even near 40." I said, "Thank you."
Right. No, that's right. You did the right thing.
You know, so I mean, I'm not. I'll deal with that when I get to 40. It did. I mean, I'm very similar to, you know, I'm really uncomfortable, doc. I mean, I came in for a checkup.
Yeah.
That's a huge step in and of itself, and on a certain level. It's like, okay, well, yeah, because I mean, like you said, I think Leon said, you know, we're out, we work, we do all this other stuff. It's like we don't, and like you said, we don't stop unless something stops us.
Okay. Let's talk about the screening.
Okay.
Is this the hardest part?
Absolutely.
The screening is harder than accepting the fact that you even have prostate cancer, huh?
Well, I wouldn't necessarily say that, but I mean, I think most men, if they feel, like for instance, you could take a young African American man that has two brothers that have prostate cancer. Oh, you have no problem getting him screened. He's running to get screened because he understands that, or somebody whose family member have died of prostate cancer. But for the average person that don't have any pain, don't have any problems, again, trying to say I need to do a rectal exam culturally, I think that's just an issue for me. You know, just wait, let me see if I understand. You want to stick your hand where now? And so trying to get them past that, make them understand. Well, this is what I'm trying to do. I'm trying to take a feel of your prostate to make sure I don't feel anything abnormal. I want to make sure I feel a smooth prostate and not feel lumps and bumps like my knuckles.
Okay.
Because if I can feel it here, and if we can screen it early, if we can find a problem early, then your chances of cure is going to be a lot higher. Once you start to explain that, men start to relax because they have an understanding of why you're trying to do it. But if you don't set them down and try to explain why, all they hear is, you want to stick your finger up my what now? And that's a hard thing to try to relate. But anyway, the screening process is, let's call it digital rectal exam. Okay. And what we're trying to do is we're trying to relax them, the rectal sphincter muscles, and then feel the actual prostate.
See, they already can't take it. This is bad.
When he say relax,
You gotta relax.